So this could be another kind of sticky situation. Sort of like when we talk about person first language versus identity first language, is this high functioning and low functioning and the levels of autism. I really am an optimist, so I'd like to think that the DSM really did try to do the best they could when we went from 4 to 5, and we were thinking about, splitting all of the autism spectrum differences versus now we lump them all together, and needing to think about, if we lump them all together, we've got to have some sort of ability to differentiate because the spectrum is a spectrum. And so these level 1, 2s, and 3s get very sticky, especially for those of us in the diagnostic space. And then when we're even communicating with others about either your child or or a patient to another allied health profession, or even me filling out Girl Scout camp forms, I have to think very carefully about how I'm going to describe Abby, because it's so easy to be like, oh, well, she's high functioning autism and she's got generalized anxiety disorder. But what does high functioning mean? Does that mean that she has high language ability? But sometimes she doesn't have high language ability and she loses her language when she's like super stressed out. And sometimes, is she high functioning because she doesn't need to stim and because she doesn't need to spin and she doesn't need to do all these things to help regulate her nervous system? But those are all outward reflections of autistic traits, right? So again, here's another one of those artists I've been talking about. Functioning labels really are based on how noticeable a person's autistic traits are, and doesn't actually reflect kind of what's going on inside. So words matter. At the same time, we don't want to deprive patients of their self-determinations and opportunities to reach their potential, nor do we want to deprive patients of necessary supports and services. So while these qualifications are needed, we have to do so mindfully and with intention of what we're trying to communicate. And so it's another one of those situations that maybe it's not right or wrong, but what we need to do is think about our intentions with that communication, and those labels.